Now I'll be demonstrating our Tier 2 exam maneuvers, meaning that they should be taught to all trainees, but they should be performed only in specific scenarios when the initial Tier 1 examination maneuvers are not definitive for the diagnosis. Now I'll be performing additional palpation maneuvers. So I will start by palpating the coracoid process under the acromion here. And then I'll be palpating the scapular spine. I will usually start by the acromion and then track along the scapular spine. And lastly, I'll be palpating the spinous processes of the cervical spine vertebra. So I'll be palpating the midline. These are all additional palpation maneuvers for Tier 2. Now I'll be doing additional Tier 2 cervical radiculopathy maneuvers. So we will start by lateral rotation. Move your neck this way, to the left, 90 degrees, to the right, 90 degrees. And lateral flexion, basically ear to shoulder, 45 degrees, the other way, 45 degrees. And extension of the neck, basically try to make your face parallel to the ceiling all the way. And then flexion, try to touch your chest with your chin. Okay, and these are all neck maneuvers. Lastly, I'll be performing Sperling's maneuver, and for the Sperling's I will do extension of the neck and lateral rotation and then lateral flexion, and then I'll be applying an axial force, and I will observe for any reproduction of symptoms or any discomfort. That concludes the Sperling maneuver. Now I'll be doing additional Tier 2 rotator cuff maneuvers. I will start with the drop arm test. So I'll ask my patient to raise your hands like this, okay, and then keep them up, and then I will try to basically lower it. I will push it down, and I will ask him to resist me and keep them up high. 1, 2, 3. Okay, and now you can relax. Now we will do the belly press test. In order to do so, I will ask my patient to touch the belly button and then raise your hand a little bit. And now I want you to push inward against my hand with the resistance. 1, 2, 3. Okay, this is the belly press testing. Now I'll be doing additional testing for the long head of the biceps, and before I will do the Yergosson test, I will ask my patient to do the active supination and pronation of the elbow. So rotate your elbow like you're turning a doorknob. Okay, great. And now I will hold your hand, and I want you to try to put your palm up parallel to the ceiling with the resistance, okay? All right, 1, 2, 3, try to put your palm up. Okay, that concludes Yergosson testing. Now I'll be performing additional maneuvers for shoulder dislocation or additional neurovascular etiologies. So I will start by doing a shoulder apprehension testing. In order to do so, I will do passive abduction and external rotation to 90 degrees. And while my patient in this position, I will try to keep doing the more external rotation, and I will apply a forward force to the glenoid to see if I can create some apprehension or any symptoms. So I will be observing my patient's face while doing that, okay? Let me know if you have any discomfort. Okay, this is the shoulder apprehension test. Now I will be doing Adson's testing for thoracic outlet syndrome. So first I will position the shoulder with some abduction, some external rotation, and some extension, and I will feel the radial pulse. And now I'll ask my patient to turn your neck towards me and then extend a little bit and then bend it. And now take a deep breath and hold briefly. I'm feeling the radial pulse. Breathe again. Now I was watching for any change in the radial pulse with weakening of the pulse or disappearance of the pulse, as well as any reproduction of the symptoms. Lastly, I will be doing wall push-up test for serratus anterior muscle dysfunction, which can be due to long thoracic nerve pathologies. So please stand up for me. Okay. Put your hands like this and try to do a push-up against the wall. And I'll be basically observing for any asymmetry or any winging of the scapula. So try to do the push-up. Yeah. In cases of scapular winging, we would see asymmetry between the scapular blades. That concludes the wall push-up testing.